Today we are going to talk about emesis or vomiting. This nausea and vomiting, these are the protective reflexes. They protect our body by ejecting the harmful substances from the body. Now, what is nausea? Nausea is a feeling of impeding vomiting. It is the phase just before the emesis. Now, vomiting is the involuntary forceful expulsion of the stomach contents through the mouth. What is vomiting? Vomiting is involuntary, it is not in our control, and it is a forceful expulsion. It is a forceful expulsion of what? Stomach content through the mouth, and that is called as the vomiting. Involuntary, forceful expulsion of the stomach content, whatever is in your stomach, it will get expelled through the mouth. Now, the word is retching or dry heaving. Now, what is this retching or dry heaving? It is a retroperistalsis. Means it is a reverse movement. It's a reverse movement of the stomach and esophagus without vomiting. We call it as a retroperistalsis. Retching or dry heaving. It is just a reverse movement of the stomach or esophagus. But there is no vomiting. That is a retching. Now, these functions, nausea, vomiting, retching, they serve as a protective function. These are the protective reflexes. These are the protective reflexes. For what? To get rid the body of harmful substances. Means it try to eject the harmful substances from the body. Try to eject the harmful substances from the stomach that have been ingested. How this substance will be ingested rather than allowing them to be retained and absorbed by the intestine. It serves as a protective function to get rid the body of the harmful substances that have been ingested rather than allowing them to be retained and absorbed. If they will get retained in the stomach, they will get absorbed by the intestine. So better we expel through the mouth, and that is called as the vomiting. Now, emetics. Drugs that cause vomiting are called as emetics. Drugs that causes vomiting or drugs that evokes or provoke vomiting, we call it as emetics. When noxious substance is ingested, vomiting has to be induced. When noxious substance is ingested unknowingly, accidentally, or homicidal, whatever may be the cause, unknowingly if it is gone into your stomach, vomiting has to induce. In any poisoning case, exceptional cases are there, but in most of the poisoning cases which are accidental, vomiting has to be induced. Now, how this vomiting has to be induced? With the help of mustard. It's very common, it will found in your kitchen. Mustard, common salt, NaCl, ipecac and apomorphine, these are the agents that we use for the emetics or as emesis, indicated in certain cases of poisoning. Certain cases, not all. But these emetics are not used. Emetics are not used, or contraindications for the use of emetics. They are not preferred in the children, or they are contraindicated in the children because there is a chance of uh, what we call it as a means aspiration pneumonia in the children, in unconscious or comatose patient, in corrosive or caustic poisoning, or in kerosene poisoning, there is a chance of aspiration pneumonia. And that's why in all these cases, use of emetic is contraindicated. Now, how this emetic acts to induce vomiting? They are required when undesirable substance has been ingested. Undesirable unknowingly, if there is something has been ingested, then we have to expel. They may act directly by stimulating CTZ centers. How they will act? By stimulating the chemoreceptor trigger zone or by reflexly irritating the stomach mucosa. Either they will stimulate directly chemoreceptor trigger zone or by reflexly irritating the stomach mucosa, so that there is a release of chemical mediators from the gut mucosa. So they will activate the vagal efferents in the gut. Emetogenic impulses send emetogenic impulses to the nucleus tractus solitarius and chemoreceptor trigger zone, and that's how the vomiting center will get activated. How vomiting center will get activated? Through the emetogenic impulses, which through the nucleus tractus solitarius and chemoreceptor trigger zone, because there is activation of vagal afferents in the gut. How these vagal afferents in the gut will activated? Because there is a release of chemical mediators from the gut mucosa. There is a release of chemical mediators from the gut mucosa, because this emetics directly acts by stimulating CTZ or by reflexly irritating the stomach mucosa. This is the mechanism of action. Now we use mostly the apomorphine. Apomorphine is used as emetics. This apomorphine is a semi-synthetic derivative of morphine, opioid. It's opioid. It's a semi-synthetic derivative of morphine. It is having structural similarity with the dopamine. Dopamine is a neurotransmitter. Apomorphine is a semi-synthetic derivative of morphine. It's opioid. It acts by stimulating dopaminergic receptor D1 D2 and acts on the CTZ center. It acts by stimulating dopaminergic receptor D1 D2 where they are present on the chemoreceptor trigger zone. Now they are given subcutaneously or intramuscularly in a dose of 6 mg. Apomorphine is given subcutaneously or intramuscularly 6 mg. It evokes vomiting reflex within 5 minutes. Rapidly act. But the problem with this, it's a opioid, so it can cause respiratory depression, it can cause CNS depression, confusion, psychosis. So all side effects are because of opioid. So there is a CNS depression, respiratory depression, confusion, psychosis will be there. Now we have the other drug, Ipecacuanha. Ipecac is obtained from the dried root of herb Syphilis ipecac. It is obtained from the dried root of herb. It is obtained from the roots. Source is the root. Syphilis ipecac. It contains the alkaloid emetine. It extracted what active ingredient is emetine. So it is given as a syrup, induces vomiting in 15 minutes. Apomorphine induces vomiting in 5 minutes. It will take 15 minutes. It directly acts on the CTZ and by irritating the gastric mucosa. It is safer than morphine, apomorphine, but onset is delayed. Onset is, it takes 15 minutes. Apomorphine takes 5 minutes. But it is very safe. There will be no respiratory depression, no CNS depression, no confusion, no psychosis. So all these are the advantages of ipecac. Okay, so this is what is we have discussed the emetics. Emetics that we use in case of certain cases of poisoning, and we have also seen where it is contraindicated. Emetics are contraindicated in the children's, in the comatose patient, in the unconscious patient, in the kerosene poisoning. So these are the contraindications, and this is how we use this emetics, ipecac and apomorphine.